Hello, my name's Helen and I'm a respiratory physiotherapist here at Airedale General Hospital. The aim of this video is to show you how to use the Acapella Choice airway clearance device. This device is given to patients who have difficulty clearing copious quantities or very thick secretions from their lungs. The device creates a back pressure as you breathe out through it, and this helps to hold open the airways, and it also creates some vibrations that you'll feel within your chest that help to loosen the sputum. Both of these actions help you to cough up the sputum more easily. Firstly, we're going to go through the components of the Acapella. There's a mouthpiece, the main body, and inside a rocker device that creates the back pressure and vibrations. To take the device to pieces, pull the mouthpiece off, and then you'll see the grooved area. We're going to squeeze and lift the top part of the body. Inside is the rocker. This vibrates as you breathe through it, and if you pinch where the grooved area is, it lifts out. This shouldn't be taken apart any more than this. To put the device back together, the two circles match up and press the rocker in, close the body and hear a click, and then replace the mouthpiece. We recommend that you clean the Acapella after every use, and certainly at least once per day. To clean it, take it into the three components, wash in warm soapy water, and then leave in the three parts to air dry. Once the device is dry, put it back together and store in a clean box with a lid or the bag that's supplied with the Acapella. Once a week we recommend that you sterilise the Acapella. The simplest way to do this is take it apart and place it in a bowl of boiling water, leave the water to cool, then remove, put back together again. Please don't use a microwave to sterilise the Acapella because it contains metal, and microwaves and metal don't match. The Acapella doesn't last forever. It needs replacing via your GP. When we issue the Acapella, we will have sent a letter to your GP telling them how to do this. If you use the Acapella every day, we would recommend that it's replaced every 6 months. If you use it less often, it can be replaced anything up to every 2 years. Please see your GP for a replacement. If you have seen a physiotherapist, they will have set the device up for you. But if you have been supplied the device by post, you will need to set it at the correct resistance yourself. At the back of the device is a dial that goes from number 1 through to number 5, and then you set it by the arrow on the top. We're going to start with the dial at number 1 and then work up slowly to get the correct resistance. With the dial set at number 1, we're going to take a slow, deep breath in, place the Acapella in your mouth, get a good seal around the mouthpiece, and then breathe out slowly. Don't breathe out with too much force. Device set at number 1, there was not enough resistance for me, so we'll turn up to number 2 and repeat. Again, the resistance is too low, so we're going to increase it. So we're now going to increase the setting to 3 and repeat. So as that is on setting 3, I can feel vibrations in my chest. The breath out is longer than I would usually breathe out, and I can feel some resistance to my breath out. I've increased the setting to 4 and repeat again. So we're going to repeat the same on level 5. So you'll know that you've set the resistance too high if you feel that you're having to work very hard to breathe out through the device, or if you feel lightheaded or dizzy using the device. It's important not to put too much effort into using the device, whether it's set at number 1 or number 5. So I'm going to demonstrate putting too much effort in. Watch my cheeks. So you'll see that my cheeks puff out, wobble, and that you can hear a lot more effort out through the device. So the Acapella can be used alongside your other physiotherapy techniques. So the physiotherapist you have spoken to will have told you which postural drainage positions to use. The Acapella can be used in sitting, it can be used lying down on your side, lying on your tummy, or even in a head down tip position. So we would recommend that you combine the Acapella and postural drainage. When you're unwell, you may need to modify all of your physiotherapy techniques for clearing your chest. The aim when you're unwell, because you have more sputum, is to do more physiotherapy across the day. But if you're tired, you will need to break it up into regular short sessions rather than a couple of longer sessions. It really depends how you're feeling when you're unwell. In terms of the Acapella, you may well need to reduce the resistance slightly because you're going to get tired more quickly. The Acapella can also be used with the active cycle of breathing. The active cycle of breathing combines deep breaths, relaxed breathing, huffs, and a cough when you have some sputum ready to clear. You would use the Acapella after your deep breath in, you would then breathe out through the Acapella, perhaps repeat that 3 times, move to some restful breathing, repeat another 3 deep breaths, breathing out through the Acapella, restful breathing again, repeat again, and then perhaps try a huff and see if you can hear or feel any sputum in your upper respiratory tract from where it will be ready to cough out. If you can't feel any sputum, then you go back through the cycle of deep breath, breathe out through the Acapella 3 times, rest, full breathing, repeat again, restful breathing, repeat again, huff, see if there's any sputum, cough if the sputum's ready to move but not before it's ready to move. We hope you found this video useful. If you would like more information, please refer to the leaflet that will have been supplied with the Acapella, your bronchiectasis physiotherapy information pack, or contact us on the number on these leaflets. Thank you.